Hi everybody, a very good morning and welcome to this webinar which has been organized for you on a Sunday morning. And it's amazing to see everybody is already in here, and it's really nice to see the audiences in place. So we are going to start in a couple of minutes. So a couple of things that I would like you to kind of, keep in mind is that it's about a 1 hour session. So if you like, you can kind of, visit the washroom and come, so that, you don't have to get up in the middle. If you want to keep some notepad and etc. ready so that you can kind of take notes, then that's something which is great too. So I'm going to give you like a minute so that you can get all of these things done. And I know it is Sunday and you're sitting in front of your screens. So if you haven't eaten breakfast, then please get somebody to get you something to eat, because we don't want you to be hungry, right? So during pregnancy, it's not a good idea to be hungry, and you should always have your bottle of water, some dry snacks, something around so that you can keep munching and eating. So we have a couple of minutes. We'll get started in 2-3 minutes. But till then, just make sure that you get all of these things organized. All right? Thank you so much. Okay, all right. So I'm sure you're all ready, and we are ready, all set to start as well. I have already started sharing my screen with you. The main focus of today's session is obviously pregnancy and, the well-being of your baby, arrival of your little one, and all of those things. So let me start first with kind of, telling you that all of you have been kept on mute. Because otherwise the session can become very difficult for us to conduct. What we've also got is a question box. So please, throughout the session, keep putting your questions in the question box, and we will make sure that before we end the session, we will answer all the questions. All right. I will give you a very quick introduction of myself. My name is Sonali Shivlani. I'm a pregnancy and postnatal consultant. I have been in this profession for more than 16 years now, and I have had the pleasure of working with more than 35,000 families in the pregnancy phase. So it's been a really long journey. On the personal front, I have 2 wonderful kids as well. So yeah, that little gray hair that I have is all thanks to being a mommy too. So my son is going to turn 20 this year. My daughter is going to be 18. So I have almost adults, and I love to tell stories. So we are going to have a great time this morning. The focus and target is we are covering exercises, and we are going to cover labor preparation. So I'm going to be teaching you all the different exercises that you can do at home so that you can stay fit and your baby can be healthy. And also, what are the tips and tricks that you need to prepare for your birth? So during labor, how do you do pain management and all of those things? Okay, so that's me. That's the focus of today's session. I would also like to take a quick minute here and thank Dr. Vinod Bharati for giving us the opportunity to organize this session for all of you. As you know, this session has been brought to you by Cordlife, and Cordlife is one of India's leading stem cell banks. At the end of the session, besides the Q&A, we have some giveaways for you as well. So all the participants will be getting gift vouchers, and then you can use that for a little bit of shopping and etc. So make sure that you stay till the end of the session, because you definitely want to get your questions answered. You want to get your vouchers. So that's the idea. All right. So can we get started? Are we all set? So that's my introduction as on my first slide, and we're going to move ahead. So the first topic for the day is obviously prenatal exercises. And this is something which all the mummies and, in fact, even daddies. So daddies also want to kind of, know whether the exercises are happening, what is safe, what is not safe. Sometimes families get really scared when they see mothers exercising. They'll be like, during pregnancy, you should not do this, you should not do that, etc. So all said and done, this is something which is a very important part of pregnancy, and we are going to cover why and how. So there are lots and lots of benefits that exercise can bring to a mother. So the first is, and very importantly, it can help to reduce, that is ease or prevent back pain and other discomforts. So I think during pregnancy, you experience so many discomforts, right? Like back pain, cramps in the legs, swelling, sometimes nausea, acidity. So many of these things can actually be helped with exercises. Exercise is also known as a mood booster. It makes you feel good. It helps you to feel, the positive hormones are flowing in your system. And that is something which is really, really positive. Energy levels are at an all-time high. It might be surprising to you. Maybe the first week or so when you start your exercises, you might feel a little tired and exhausted at the end of the day. But slowly you will realize that exercise actually makes you feel more energetic. Interestingly, exercise also helps you to sleep better. I have a prenatal class. Of course, now mothers are not coming in for regular classes. But when we used to have regular classes, they used to actually tell me that we should have the classes every day. Because the day we have the class, we sleep better. Right? So make sure that you do a little bit of exercise. It will help you to definitely sleep better. Now this one is a favorite of mine because it kind of helps to maintain my weight. It helps to prevent excessive weight gain. During pregnancy, weight gain though is expected. It's normal. But if we can take care of gaining just the right amount of weight, which is necessary for the pregnancy and for the baby, then we will be able to lose that better as well. Trust me, ask me. Both my kids, they're my grandparents now. I call them that. If I put on even a little bit, they'll keep telling me, Mama, you should exercise, right? It helps to increase your stamina and your muscle strength, which is really going to be beneficial, especially for labor when you're pushing the baby out. It can reduce the incidence of pregnancy complications because you're healthy, because your hormones are in balance. So many pregnancy complications like gestational diabetes, thyroid, hypertension, all of these can be greatly reduced. And of course, it helps you in your labor and delivery. Let me kind of, give you a little bit of a visual example. So that is your pelvis, and most of the prenatal exercises that will make you do for labor preparation will help to exercise this pelvis. So the pelvis becomes more and more elastic, and when the baby is ready to come through, it will be able to stretch a lot more smoother, right? And it also results in a faster postpartum recovery. So that is something which is really, really important because after delivery, the work actually begins because I have to start taking care of my baby, and that's a lot of hard work, trust me. So the first thing that I'm going to talk to you about is your pregnancy posture. Before I even get there, of course, posture and all is something which you can definitely start practicing right from the beginning. But for all other exercises, it would be a good idea to take permission from your doctor before you begin. Because exercise, obviously, we are moving your body. If there is a pregnancy complication, maybe a low-lying placenta, maybe you've had bleeding, maybe your cervix is short, you never know. We don't know that externally. It's only your doctor who knows all these details. So always check with your doctor before you get started. Now let's look at how your posture is. 90% of back pain during pregnancy is posture related, right? So what happens when we sit? If you see the woman on the left, she's actually slumping and slouching. She's not sitting erect. She's not sitting with her back well supported. But if you see the woman on the right, she is sitting straight and she is sitting with her back fully supported. So your back actually starts here, right? Right here in the pelvis. This is all part of your back. So the buttocks are right here. These are your buttocks. So if you're going to sit like this, you can imagine what's happening. Look at how your back is tilting. And that is not something which is great. All of these bones are going to start hurting, right? So that is something which is really, really important and essential to remember, that whenever you sit erect. Another thing that I normally recommend to all my pregnant mamas is that you should take a small pillow, the type that we keep in the car, keep it behind your lower back. So that is going to ensure that you get good back support and your lower back, which has a little curvature, will get well supported. This is your standing posture. Now let me tell you a little something about how the back works, right? So assuming this is your spine, and normal person also has a little curvature here, right above the buttocks, in the small of the back, there is a little curve over here, correct? Now when we have a little curve over here, that's normal. But when pregnancy happens, the stomach starts growing, the weight starts increasing, due to which this is what happens. This curve becomes more exaggerated. So obviously that kind of puts a lot of pressure and weight on the lower back. The other thing that happens is the chest size increases. So the breast size also changes during pregnancy. In preparation for breastfeeding, it's normal, it's physiological, that's to happen. But because of that, the shoulders start hunching forward like this. So the mother has a posture which kind of looks, like a S. And that can be a major issue. So that kind of becomes a problem, and it's a good idea to make sure that you are standing straight. Always stand erect, always kind of, push your shoulders back, make sure that, your chest is slightly sticking out and your spine is straight. Now that we are ready to start, let us understand what exercises would be good for us to do, during pregnancy. So the first thing we do is neck rotations. I'm going to make it really simple for you to understand this, because what happens is that due to circulation becoming less, and it's really simple, during pregnancy, your blood volumes become at least 50% more. Plus, it becomes thicker because it has to carry more nutrition for the developing baby. Because of this, now 50% more blood, thicker blood, it is going to make the arteries and veins carry more blood. So therefore, there is a little bit of circulation issues. We don't get thicker arteries, bigger veins, due to which we get all of these pregnancy discomforts, swelling, cramps, maybe headaches sometimes. So we're going to move every possible part that can be moved. So every joint we're going to be moving. Okay. So we'll start with the neck. And one thing that you should always remember is do this really, really slowly. Do not be in a rush. It's perfectly all right to kind of, do less counts, less numbers, rather than doing it too much. Okay. So the first thing that we're going to do is neck rotations, and you can do this wherever you are sitting. This one, of course, is really simple and it's not involving the abdomen. So we'll slowly drop your head down, touch your chin to the chest, feel the stretch at the back of the neck. Now drop your head back. All right. And then now what we're going to do is a full rotation. So drop your chin down. Left ear to left shoulder, back of the head to the back, right ear to right shoulder, chin to chest. And you can reverse this as well. Go right ear to right shoulder, back of the head to the back, left ear to left shoulder, and chin to chest, right? So you can do as many counts as you feel comfortable. You don't need to fix any timing of the day. This is great for circulation to the head and should be included in all of your routines on a regular basis. The other exercise that we do is wrist rotations. Now, many times women will complain that they get a lot of pain in the hands, there's swelling in the fingers, right? Now, what happens is that during pregnancy, this would be my suggestion, recommendation, and I call this a quick check for you at home. Your finger rings should fit you like this all throughout your pregnancy. right? If they are not fitting you, either you're getting swelling, which is a warning sign, maybe your blood pressure is rising, etc., or you're putting on weight, which is not a good idea. During pregnancy, you should gain weight only in 3 areas. You should gain weight in the abdomen, of course. Your buttock sizes will change because they need more space for the baby, and your chest size will change. That's it. Your face, your fingers, wrists, all of this should be absolutely normal. Now, the main thing is that for some women, it's just, again, I'm sleeping in one position, so therefore I get a little bit of, puffiness. Maybe I work too much on the computer, so I get puffiness. So all of this can be a reason. So we can do these wrist rotations throughout the day. And again, we do them really slowly. So it is literally circle and then circle the other way, right? The next thing we're going to do is for your feet. So wherever you're sitting, if you sit long hours to work as well, if you have to just, maybe even if you're sitting to watch TV for a long time, very interesting movie, can't move, you're there for 2.5 hours, then you should be definitely doing your foot exercises. And it's very simple. You're simply pointing your feet and you're flexing them back. So you're pointing your feet and you're flexing them back, and this is great for your calves. And then if you like, you can also do the full ankle rotations, which is going to ensure that your ankles also don't get swollen. This exercise is amazing as far as labor preparation is concerned. So it's really simple. All you need to do, and I would recommend that you do this, on a stable surface. If you can do it on a mat, I'm happier. But if not, then your bed also should not be like a bumpy bed. It should be a nice, firm surface. So sit on the mattress or on the mat. Bring your feet together, the soles of your feet together, and your knees can be as low as possible. Pull your feet in as close to the pelvis as you can. And then you can kind of go flap, right? So flap your knees up and down the way a butterfly would flap the wings. This exercise is great to do all throughout the day. So if you want to talk on the phone, watch your favorite TV serial, maybe you're just sitting to chat with your husband, try and sit in this position for as long as you can. If you feel tired, you can straighten out your legs and then do some ankle flexes. That will really, really make you feel comfortable. But the butterfly helps to widen up the pelvis. So when I'm sitting in this butterfly position, I'm literally doing this to my pelvis. So my normal pelvis is this. The butterfly will help to stretch the pelvis that much more. So if you think that all this is going to cause your labor to happen sooner, that's not true. Your labor will still happen later because the pelvis is only the exit point. It is not the uterus. So we are not affecting the uterus with any of these exercises. So if you have a healthy, normal pregnancy, this is only making your pelvis more elastic, which will help the pelvis to stretch easily when the baby wants to come out. For all those mamas who are facing backache, we can do the cat and camel pose. So this one is highly recommended to be done only on a mat. Please don't do it on the bed because if you'll be a little unsteady, unstable, and that is going to put unnecessary pressure on your back. Get onto all fours. Both your arms are below your shoulders and your knees are hip distance apart. Now what you're going to do, in the first picture we're showing you the cat pose. You've arched your back and you're looking up at the ceiling, and then you're going to round out your back and you're going to look down at the navel just like a camel hump. Okay? You can do about maybe 12 to 16 of these every day, and again do them really slowly, because when you do a position like this and hold it there for 4 counts and then turn around and do a position like this and hold the posture for about 4 counts. This one is also excellent for your back. Again, make sure you do it on a mat so that you have good stability. Lie down flat. Your feet are on the floor and your knees are pointing towards the ceiling. Place both your hands next to your hips and now slowly elevate your buttocks and hold it for 4 counts as high as you can. Always ensuring that you don't hold your breath, because many times when mothers get into a position like this, they will also hold their breath. And we don't want you to do that, right? During pregnancy, breath holding is not allowed. Even if you're used to doing yoga, asanas, etc., there are a lot of asanas where they ask you to hold your breath while getting into the asana, and that is not something which is recommended during pregnancy. This exercise is also amazing and it's great for your labor preparation. So what you need to do, again, back to my mat, lie down on your side, make sure your body is in a straight line. I would fold the lower leg because I would want your body to be stable. It will not wobble. And the next thing you're going to do is raise one leg up all the way to 90 degrees. It's really important. It's 90 degrees. Okay. So see what happens to your pelvis. This is you lying on your side. When you raise the leg to 90 degrees, this is literally how your pelvis moves. If you were to raise it less, then this is how much it will move, right? So a lot of times mothers will raise for like 45 degrees and etc. But what I tell them is that please do less. Do only 8 counts if it's not possible to begin with. But do the 90 degrees because you get this much opening, right? So you get this much opening of the pelvis, which is excellent preparation for labor and delivery. Then come your squats, your very, very famous squats. A lot of times mothers are told that they should be doing chadu katka, cleaning and swabbing the floor in the 9th month. Don't worry, I'm not going to ask you to do that, but I'm definitely going to ask you to do some squats. When you're doing squats, take some support because you are pregnant, you don't want to wobble, you don't want to kind of, have a problem. So it's a good idea that you have a firm chair. If you can't find a firm enough chair which is going to support you, you can do this against a wall. Or a favorite suggestion of mine is to also do it with your husband. So you can hold on to your husband, so you have him for support and you can do your squats. That's great for bonding also, isn't it? So you hold on to something firm, something solid, something supportive. Spread your legs really wide. If you can see this picture, I've also pointed the toes outside. So the toes are pointing outside and you're going down tall and straight, right? So the back is completely tall and straight. We're not going down all the way. We're going down halfway. So we're kind of getting to the point where your thighs are parallel to the ground. And you can start with 8 to 10 squats every day. But as pregnancy progresses and your stamina increases, my class can easily do about 100 squats every session that they come in. So, but of course, there's a lot of motivation and I'm supervising them and etc. So just make sure that you kind of, do your squats on a regular basis. Now the next thing we're going to move into is preparation for your labor and delivery. So that's a big word, labor and birth, right? So let's see what happens as far as birth is concerned. And again, just as a reminder, if you are having any questions, please make sure that you keep putting them in the questions box so that I can then answer them once my delivery of the session is over. Okay. So first thing that you should all be aware of, labor should not start before week 37. It is not a good idea because then it becomes preterm labor. So if labor begins before 37 weeks, the chances of the baby needing the NICU become higher. So if you start feeling any kind of signs and symptoms that you may probably be going into labor, like you're getting a lot of discharge, maybe the vaginal discharge increases, maybe you're leaking, maybe there's a little blood, or you're feeling any kind of contractions, then you should immediately report to the doctor. What happens when labor starts? The first thing that is going to happen is contractions. So when it is false labor, the contractions are not regular. When it is real labor, the contractions are regular. They have a pattern, they have a rhythm. So let me tell you what I mean by that. If I have a contraction which comes at say 10 o'clock, lasts for say about 20 seconds, and then I have my next contraction which maybe arrives at about 4 o'clock in the evening, lasts for about 15-20 seconds, then I have nothing all day and maybe I feel something in the middle of the night. There is no pattern in this. This is not regular. But when it is real labor, you may have a contraction at 10 o'clock lasting for about 20 seconds, another one at say 11 o'clock, 20 seconds, 11:45, maybe 25 seconds. We're starting to see a pattern, right? And what we're also seeing is that the frequency and intensity, that means the contractions are coming more and more closer together, and the pain that you're feeling or the discomfort that you're feeling goes on increasing. It can feel like period cramps. It can feel like pain in the back, spasms in the back. Some women even report a lot of weakness, so they feel pain in their thighs and etc. Anything which feels out of the ordinary could be labor. One quick tip that I can give you to determine whether it's real or false, right? So suppose you're feeling a contraction, get up and walk around. When you get up and walk around, what you're going to feel is if the contraction increases, it means this is real labor. If the pain, intensity, all of that goes up, then it is real labor. But if you get up, so I feel a contraction, I get up, I walk around, and it kind of subsides. It goes away. This is probably false labor. Can I share a quick secret? For most mothers, labor will start in the middle of the night. So it could be 3 a.m., 4 a.m. And do you know why? Because one of the golden rules of labor is the more relaxed a mother is, the faster labor will progress. So most women will go into labor in the middle of the night because that's when the mother is the most relaxed. So now you're feeling your contractions and you're thinking you need to wake up your husband. But what you can do first is just get up, walk around, maybe go have a drink of water, visit the bathroom, see if you feel better. If you feel better, it's probably a false alarm and you can go back to sleep and wait till it becomes more regular and more rhythmic. The best time to go to the hospital in our understanding is when your contractions are regular and they are approximately 20 minutes apart. So when you decide that, okay, I think this is labor, then you have to start making notes and, start writing down what time the contraction came, how long it lasted. And if the time duration between the contractions is about 20 minutes, then it's a good time to go to the hospital. Most mothers will still take a few hours to deliver after this, so it's a safe zone. But you should still discuss this with your doctor so that you can be sure that this is the time that the doctor wants you to be coming into the hospital. Another time to go is when you find that your water bag has broken. So whether it is leaking or it is a gush of fluid, even if there are no contractions, it means the baby's sterile environment is open and you should be going into the hospital. If either of you are feeling nervous, right? I mean, I'm talking about you or your husband, because many times what happens is after learning all of these things, moms know that, okay, fine, I have enough time. So the mother is sitting very calmly and practicing her breathing exercises, but the partner is getting very nervous. If your husband is walking all over the place and worrying about it, it's better to take him to the hospital. Right? So at least you feel secure and you are in safe hands. In case your hospital is very far away, if it's going to take you hours to reach and if you know it's traffic time or whatever the situation, then also it makes sense that you should go into the hospital. What will happen when you reach the hospital? Your doctor will check you and then the doctor is going to determine first and foremost if this is real labor or it's false labor. And it's okay to have a few false alarms. It's fine. If you're a first-time mother, these goof-ups are normal. And you can just laugh, maybe have a nice cup of coffee somewhere and come back home, right? If the doctor says that, yes, I think you are in labor, then you are going to be admitted. Once you are admitted, they're going to keep monitoring your vital signs, your blood pressure, your heart rate, or your vital signs will also mean they'll keep checking and doing internal examinations to check what the cervix feels like. So remember we said there are two factors in labor. First was the pelvis. The second is the cervix. During pregnancy, your cervix is like this. It's long, thick and tightly closed. And once labor starts, the cervix starts becoming shorter. So when the doctor checks, does an internal examination, does that vaginal exam and checks, and if the cervix feels shorter, thinner, then the doctor knows that you're probably in labor. The baby's heart tones are also monitored to ensure that the baby is doing just fine. And most labors treat babies really well, so you don't really need to worry. If all is well, then labor is going to be allowed to progress naturally. So we don't interfere, we do not disturb, we say, okay, labor can move along absolutely normal. So this is what is going to happen in the first stage of labor. These two big long words, effacement and dilatation, right? The first I already told you is the cervix is going to become shorter, and this is called effacement. So the cervix has to become absolutely paper thin and flat, right? The next thing is the cervix is going to open, and the cervix has to open to 10 centimeters. So every time the doctor does that exam and checks, now we can insert one finger. So this becomes a 1 centimeter dilated cervix. At the next exam, if the doctor checks, it might be 2 or it could be even more. So the doctor can check and determine. Eventually, the cervix has to reach about 10 centimeters. And this is the size of the baby's head. Then comes the second stage of labor. In the second stage of labor, the baby is going to actually make an appearance. So the baby is going to be delivered through the pelvis. So this is what is going to happen. And that's why, as I said, the pelvis needs all that flexibility, right? So the baby is coming through with every push that the mother is giving. The baby is coming in lower and lower and lower. Now the baby's arms are stuck. So obviously we need to kind of wait for the baby to turn. And the babies will do this on their own, right? So what the baby will do inside is the baby will turn literally like this. And this is happening on its own. See how smart and intelligent your baby is? The next thing the baby is going to do is the baby is going to push one shoulder out. Then the baby is going to push the other shoulder out. So while the mother is pushing, the baby will also align himself, one shoulder up, then the other shoulder. So the baby is being very cooperative. And finally, as the process moves and all the pushing happens, the entire baby then slips out. So that is what happens in the second stage of labor. In the third stage of labor, the contractions will resume. Now the baby is delivered, so the mother's mind is like, oh, I'm all relaxed, I'm done, right? So the mother is all relaxed and chilled, but the doctor still has to wait for the delivery of the placenta. The placenta during pregnancy was the baby's nutrition, oxygen, all the support organ work the placenta was doing. Now the placenta is not required. So the placenta will separate from the wall of the uterus and it will also pass out with the subsequent contractions. The mother may be asked to push a little more, but this pushing is really, really easy and the entire placenta is delivered. So as I told you, the golden rule of labor pain management is basically relax. So the more relaxed you are, there is less stress and therefore there is less pain. If there is less pain that the mom will experience, then obviously labor will progress much faster. And the best labor management tool is actually stress management. So what we need to teach you is tricks to keep you calm and relaxed. Now, obviously, there are lots of medical methods to give you pain relief, and your doctor will discuss all of these options with you if you need them. We would recommend that you have a frank discussion as to what your options are, understand the pros and the cons so that you are better prepared at that point of time if you need to take any medical pain relief. But what I'm going to teach you is some magic tricks which will help you to manage your own labor a lot more smoothly. So the first thing we're going to do is we're going to avoid screaming. So what I want you to do now with me is a little quick exercise sitting right there wherever you are. Okay? So just sit back and relax, be comfortable. And the first thing you're going to do is keep your facial muscles absolutely calm, relaxed. Okay? Now, while you're doing this, think about what your vaginal muscles are feeling like, right? Think about what your vagina feels like. It feels absolutely neutral. Now, the next thing you're going to do for me is you're going to frown. You're going to kind of, make a really grumpy face as if you're angry at something. So, right? And when you do that, can you think what happens to your vaginal muscles? What your pelvic floor feels like? It kind of feels as if it has tightened up and it has contracted. And that is also something which is normal. Now we're going to switch gears a little bit. And what we're going to do is we're going to again come back to our relaxed expression. But this time we're going to smile. So, all right. Can you notice the difference in your vagina? So I made you do 3. I'm not making you scream. But just try this without making the sound. Make the screaming face. Right? Do that. Doesn't your vagina feel all tight again? This is completely what happens. So during labor, if you start screaming and shouting, your vaginal muscles become tight. That's where the baby has to come out from. You saw how much work the baby has to do. So the entire process will become longer. If you are not going to do this, then what are you going to do? We are going to breathe. That is very important, right? So when we are breathing, I know it must be really, oh my God, breathing. Of course, I know how to breathe and all of that. But the main thing is that you have to ensure that you breathe in short breaths. And I'm going to teach you how to do it. I would strongly suggest that all of you, please do this with me. If you're using the laptop or you're using your phone for this session, just position it in such a way so that you can see what is happening and then do the breathing exercises with me. Okay? So we'll do two cycles together so that you know how you're supposed to practice. Okay? So sit back really comfortable. Keep your eyes closed. Now imagine that you have a contraction coming on. Take a deep breath in. Exhale. Now switch to short breath. Breathe in through the nose, blow out through the mouth, and this is what it looks like. Just short breaths, breathing, blowing out, keep going. I won't make you do a very long contraction because you're doing it for the first time. All the time, keep focusing on your mind. Keep telling yourself that every contraction brings the baby closer to me. This is normal. It's natural. I'm going to cope with this. And the contraction is going away. So take a deep breath in and relax. Now, in between contractions, there's no pain. So what you are going to do is you are going to be completely loose and limp. Allow your body to relax. Many times there is a lot of tension. We kind of, scrunch up our hands. We tighten ourselves up because we are so worried and we are so stressed out. We are wondering, where's the doctor? Why is no one coming in? I mean, I'm having so much pain, but no one is checking up on me. Don't take tension on all these things. Labor is normal. It's physiological. The doctors are really not going to need to interfere if everything is doing well. Okay? So spend this time to conserve your energy and relax. Right? Now you can feel another contraction coming on. So take a deep breath in. Exhale. And you know the drill. Breathe in through your nose. Blow out through your mouth. Keep going, short breaths. It's breathe and blow, breathe and blow. And the contraction is disappearing. So take a deep breath in and relax. All right. Now very important. Please remember, if you don't practice, then it will not come to you naturally during labor also. So it is very important that you should practice this every day, starting from week 28 onwards. So once you reach the 28th week, at least 4 to 5 such practice breaths I did about 30 seconds in each one. You can do it slightly longer. You can do about 45 seconds to 1 minute because that's how long contractions can really last. When you're doing breathing exercises during labor, it will help to distract you because you have to think. It's something different, right? So your mind diversion will happen. It is going to provide oxygen to your muscles. Muscles which are well oxygenated, painless. So your uterus, your lungs, everything will be well oxygenated, and your abdominal muscles will also have the oxygen which will help to push the baby out. With every contraction, there is a squeeze in the uterus, which means the oxygen flow to the baby is reducing. But if the mother is doing a breathing exercises, the oxygen flow remains steady, which means there will be less chances of fetal distress. I think that's also one of the things we hear, that the baby had a problem, which is why I had to have a C-section. This will also help you to manage your pain better because more oxygen, distraction, you're feeling positive, you have something to do. So your mind does not focus on the pain. The next thing that I would recommend is visit the bathroom. Now what happens is, or why am I asking you to do this, right? This is something which you have to keep in mind. This is your pelvis. It has 3 organs inside. It has your bladder, it has your uterus, and it has your bowels. So for most women, before labor starts, you may experience multiple bowel movements, or the doctor may give you an enema to empty out your bowels. This is completely normal process. The other thing that you can do is every 45 minutes to an hour during active labor, you should go to the bathroom to pee. Because when you pee, you'll empty your bladder, you'll create more space for the uterus, and the baby will move down faster. And also, when you pee, you're really relaxed. You can't be tense and pee, isn't it? It's a good idea to try to be in an upright position. So if you look at the woman lying down, her birth canal is not like this. You know, this is the uterus end and this is the end of the vagina. So it is not that the baby has to come out straight like this because the woman is lying down. The birth canal is actually like this. So if the woman keeps lying down all the time, the baby has to do a climb like that, right? So that becomes a issue. That becomes a question. So what the mother should do, as much as possible, you can rest also. It's not that I'm saying sit only for the entire duration, but as much as possible, try to sit up also. So when you're sitting up, you give the baby the advantage of gravity, plus the way your body is designed, the baby will be able to move down faster. All of you have pillows in the house. So you have a big fat pillow which is on a tight pillow cover. If you want to remove the pillow from the pillow cover, you're not going to just hold on there and say, okay, all right, it'll come. You'll be standing there the whole day, isn't it? But instead, what do? We shake the pillow, we shake the pillow cover, we pull a little bit, we do some activity to get that pillow out. And that is something which is what movement will provide. So if you're allowed to, you should walk around, you should move around, you can even dance a little bit, you know, that nice swaying movement. Do you know that belly dancing is actually a birthing dance? Because when the woman does belly dancing, the entire pelvis is rocking, right? So yeah, maybe belly dancing might also be a good idea during labor. Having natural pain relief is obviously great, right? So try and relax yourself, make sure you're all calm and comfortable. Again, back to square one. It's normal. Women are having babies every second all over the world, right? So many things right now. We have a pandemic going. So many things have stopped. But has birth stopped? No, because it's a natural event. So just accept that, and your body is designed for it, so relax. All the breathing exercises will help you. So ensure that you are practicing your labor breathing exercises from week 28 onwards. Massage can be really, really helpful, and I'm going to show you some nice massage positions. So your partner, whoever is with you, can help to give you some massages during labor, which will help to make you feel relaxed. Imagery, which means we're talking about thinking about positive things. Maybe remembering your honeymoon, that, you know, very special time, or very great Valentine's Day. maybe the first moment when you found out the excitement of being pregnant. So kind of, think about positive things. If you know about acupressure, maybe you could try some acupressure also. Some of the acupressure points are, here in the hand, and also some are there in the feet. So you can kind of, press the small of the toe, the back of the ankle. All of these areas can actually also provide some quick reactions during labor and diversion. So your partner is with you. I had one mother who was like, a hardcore Friends, that is the sitcom. She used to love that. So what she did was she picked up an entire stack of the DVDs and she was watching Friends during her labor. So whatever works for you, maybe you like to chant mantras, listen to music, read a book, whatever helps to distract and divert your mind. Here are some areas which could be great for massage. So the lower back, and your partner can use, this firm kneading movements, or also use the base of his hand, his hard part of his hand, to give circular movements of pressure. The neck and the shoulders, because you're all the time tense, can be really, really relaxing. So this can be a great massage point as well. Some mothers may even like a little belly massage, which is absolutely fine. So, but it has to be really gentle. So we can't use firm pressure on the belly. It's a good idea to also continue eating and drinking during labor if your doctor is allowing it. So check with your doctor if everything is normal. Having small portions of liquid and food can be really helpful. So keep sipping on water, or you can also suck on ice chips because it will help to keep you well hydrated. Having high sugar foods in tiny bits, things like glucose water, sugar, sweets, glucose biscuits, or small pieces of chocolate can keep your energy levels high. Sugar is an energy booster, isn't it? It gives you that quick up. You should avoid eating large meals because you might get vomiting. Labor pains are definitely a reality, and it could also become risky in case you need an emergency surgery for some reason. It can, of course, be a situation if your doctor feels that for the best interest of the baby and the mother, a surgical birth needs to be opted for, then you should not have your stomach content very full. You have to remember that birth is a new beginning, and therefore it is a good idea to welcome it with a lot of positivity. So I'm at the end of my presentation. I'm going to be answering the questions now. As you guys know, this session has been brought to you by Cordlife, and Cordlife is one of India's leading stem cell banks. So the first thing that all of you as participants are going to get is the Hungry Brain voucher. So it's a ₹1,000 gift voucher. It is going to be sent to you by the Cordlife team in the next 24 to 48 hours. Somebody from the team will call you and will arrange to get this voucher sent across to you. Hungry Brain basically is a brand which creates sensory stimulation kits. So once the baby is born, you can use their products, their flashcards, etc., to do some sensory stimulation for the baby, and that's great for brain development. And of course, we all want smarter babies, right? The Cordlife team will also request you for a presentation so that you can learn more about stem cell banking. And if you do choose to take the presentation, then they will also give you a complimentary online pregnancy class, which is run by me. So I look forward to having you in that program as well. So when they call you, please do take that call. The third thing is a recording of this session will also be shared with you. So you will have a reference point for all the topics that we have covered. So lots of things coming your way. So make sure that you definitely do take that call. I'm going to start taking the questions now, but I would also like to share my own contact details with you. My portal is baby360degrees.com. You can visit that, take a look at all my programs and offerings. I am also on Instagram and Facebook, and these are my handles. So at Baby 360 Degrees, I would love to have you follow me. We keep sharing a lot of things there. And I have a YouTube channel, which is the Pregnancy Coach by Baby 360 Degrees. I post a new video there on a weekly basis. So that's also a great learning platform for you. So I look forward to having you join me in all of these areas. Now I'm going to go in and see if there are any questions, and we will start answering those. So the first question is it okay to lie on the back during the 8th month of pregnancy? Archita, the basic point here is that when you lie on your back, especially in the 3rd trimester, the uterus is really heavy and it is going to press against the vena cava, which is the blood supply to the uterus. So for most healthy pregnancies, it is not a problem. It's okay. So as long as you feel comfortable and you are okay with it and you're not feeling breathless, if you find yourself on your back or you need to rest a little bit on your back, it's perfectly all right and you don't need to worry. So if you find yourself on your back, don't panic, but try and sleep more on your side, either the left side or the right side. The left side is obviously more beneficial because the digestion process is also helped. So my next question is from Prasiddhi. Are these exercises restricted in any months, like any of them for 3 months, pregnant mother or something? No. Generally what we suggest is, most important, ask your doctor before you start doing any exercises. The first trimester we always restrict and we say that, we don't have your ultrasound. So it is a very good idea to wait for the full ultrasound, and after 12 weeks you can start everything. So check with your doctor. If the doctor gives a green signal and you have a detailed ultrasound scan which happens in the 12th week, and if everything is normal, then all of these exercises can be started. So that also answers Monali's question as to from which month these exercises can begin. So the next question is coming from Archita again, that how can we avoid vaginal cuts by exercise? One of the simplest exercises that you should include in your routine then, if you're looking at preventing perineum tears or an episiotomy, as a vaginal cut is called, is doing your Kegels. So when you're doing your Kegels, the way you do this is sit comfortably, make sure that your breathing is normal. Now slowly tighten your pelvic floor, that's your vaginal muscles, pull them in as if you were trying to stop the flow of urine, and then release. And then once again, tighten and release. Tighten and release, right? So do this about, I know it's going to sound like bizarre, but you can start with about 50, but I would ideally recommend doing about 200 such exercises every day. You can break them up. You can do 10, 15 at any point of time and do it 10 to 15 times a day. So that way you'll get your counts done. Just remember to keep your abdominal muscles relaxed and keep your breathing also relaxed, right? All the other exercises, like your butterfly, your squats, etc., will also help to make your vaginal muscles more elastic. So if it's allowed and it's permissible, then you can definitely, go ahead and do these exercises to prevent. Any suggested food which will help to ease a normal delivery? No, there is nothing like that. These are all myths that, if you have ghee, chuaras, all those garam foods, the delivery will become smoother. These are all myths. There is nothing which is going to be, which you can eat, which is going to make your delivery happen faster. Back pain, if it is like a spasm, which means it comes and it goes. So this is a question from Priyanka. Can back pain be a sign of labor? So no, Priyanka, if it is a regular dull back pain, which is posture related, we don't call it a sign of labor. But if it is a spasm, which kind of, grips your back and it feels like really miserable and then it's gone, then that is supposed to be, possible that it is a sign of labor. Which position is best to sleep in after the 4th month? Indira, it's the same answer. You can sleep in any position that is comfortable to you as long as it's not on your tummy. The most recommended position is to sleep on your left side because there the blood flow and digestion both is optimal. I have a question from Ankita. She wants to know, is road traveling safe in the 8th month of pregnancy? Ankita, this is a question that your doctor will answer, whether everything is okay with your pregnancy and you can travel by road. The second thing that you have to also ascertain is how long is the journey. So a couple of hours is generally okay. But if it's a very long journey, like I had a mother who wanted to go from Bombay to Delhi by road because she did not want to go by air. So that, of course, was a really long journey. And even, her doctor was not very keen on it. So it's a very, very loaded question, which will need a lot of more specifics to come up with the right answer. Then I have a question here from Nikki. She wants to know if there is any specific timing for exercises like morning or evening. No, my dear, there is no specific timing for the exercises as long as you get them done. There have been mothers who've actually told me that they get up in the middle of the night and they've been experiencing back pain. So they lay out their mats and do some cat and camel postures and then go back to sleep. So 3 a.m. also. So just as long as you get the exercises done, because that's what is essential for your body. All right. So I have a question from Anju. You mentioned to have a bit of sugar to ease labor, but won't it increase sugar level in your body, which is not good for normal delivery? So, once you started your labor process, the focus of having that little bit of sugar is to ensure that, your energy levels are maintained. Of course, if you have gestational diabetes, then you should not do that. But in normal circumstances, if you have little bit, and I'm not saying to have a lot, I'm saying to have half a teaspoon, maybe half a glucose biscuit, Glucon-D in a chilled glass of water. That is what is being recommended. So it's not a whole lot, and that also not like a lot, right? I mean, again and again, every half an hour, 45 minutes or an hour is when you can take this. It will help to boost your energy levels. So Ruchita would like to know how to avoid stretch marks or reduce it, as most of the pics shown don't have any stretch marks. Yes. Stretch marks, my dear, are hereditary. It depends on your skin. Yes, there are creams and lotions. I would recommend something with vitamin E. You should start applying them as soon as you enter the 12th week of pregnancy on your abdomen, breast, and buttocks. And then you should also continue applying them for a few weeks post-delivery as your abdomen starts going back. So that is the application of oils and lotions. Keeping yourself well hydrated is great. So drink plenty of fluids, and increasing natural collagen levels by having optimal amount of fruits and vegetables will also help to keep your skin elastic naturally. So that means there will be chances that there are less stretch marks or no stretch marks. That is the best avoiding that I can give. If you understand what are stretch marks, the skin is stretching because the uterus is growing. I can't stop that. But the point that it cannot stretch anymore, it just tears, and that is your stretch mark. So yes, Monali, you can do exercises at any time throughout the day. Also what I recommend is that don't exercise on an empty stomach, but also do not exercise on an absolutely full stomach, right? Because if you're absolutely full, you just had your lunch or you just had your dinner. I've seen this happen with a lot of people, a lot of women. They'll have their dinner and then the husband is at home, so both of them will go down for a walk. And that is the only exercise that they get throughout the day. So keeping that in perspective, that's not a good idea. You should exercise on a small snack. So maybe you have some fruit, you have some nuts, or you have like a glass of juice, something like that, a small snack so that you have enough energy, and then you go for your workout and you can come back and eat your meal, or you can eat a heavy snack after that. Okay. Indira is asking about cramps in the legs while sleeping. The most general cause obviously is low circulation because the blood is thicker and a lot also now it's increased by 50%. So the best thing that you should do is make sure that you are having enough water. So we recommend minimum 8 glasses, but you can increase that to 10 and 12 also. So have enough fluids during the day. Do not sleep without a cover. So you can wear pajamas or leggings at night when you sleep, and don't sleep in the direct draft of the AC or the fan. I've also shown you those foot exercises. Do them in the evening. And if the cramps do not reduce, then let your doctor know, because it is quite possible that it is a vitamin E deficiency. So you have abdomen cramps while sleeping only. That's really odd. We have not seen any incidents of having cramps only while sleeping. So this may be digestive related. So try sleeping. Like, don't go to sleep immediately after eating. Don't lie down immediately after eating. Continue sitting for some time so that your food gets digested. And sleep on your left side, because digestion is optimal when you sleep on your left side. So that would be, the suggestion for abdominal cramps. If you don't have cramps in the abdomen all through the day when you're upright, I would purely attribute it to digestion concerns. So I think all the questions have been answered. Is there any more questions that are there? We would really like to get some feedback as well. I hope you've enjoyed the session. If you can put in some comments on, whether the session was helpful for you, did you like the session, and etc., that would be great. Great. So I don't think I have any more questions coming up. You will receive all of the things that I spoke to you about: the voucher, the presentation call, the recording of this session as well. Thank you, Ruchita, for a compliment. I'm glad you enjoyed the session. Thank you, Archita. I'm also looking forward to all of you joining me on my various social media handles. So they're up there on the page. So make sure that you like and subscribe to all of them. So that is going to help us to stay in touch. Thank you, Nikki. So a lot of these exercise videos and other content also I keep posting on my various handles. Thank you, Nisha. Thank you, Sumi. I'm so glad you attended as well. We were also concerned that it's a Sunday morning. We're really waking people up super early. But I guess it's great to get it done first thing in the morning. Now you ladies are going to get busy with your household work. So we will let you be there and have a great day. It was really wonderful talking to you, and we look forward to having you join us for other sessions as well. Have a great day, everybody. Thank you, and bye-bye. And see you soon.